With me is Chairman and Managing Director of Biocon, Kiran Mazumdar. Great to have you with us. Want your initial comments on what is the current need that government has in terms of their own focus around healthcare system?
I've been pretty vocal about the fact that the government is highly underinvested when it comes to healthcare. And I would like to use this opportunity of hoping that the forthcoming budget does address the dire need to up its investment in healthcare. For too long we've been hearing about successive governments talking about doubling and trebling our healthcare spends from less than 1% of GDP to 2 and 3%, and it hasn't happened. I think today as a country we really need to seriously think about universal healthcare and how we're going to deliver on that aspiration. I think the government has to find more investment in these areas of insurance, of reimbursement, and of really focusing on certain sectors like NCDs and of course how do you bring down infectious disease burden, and all of this is going to require a lot of investment. I do believe that when you're basically staring at a huge deficit of hospital beds in this country, when you're already discussing this very alarming increased sort of spends or billing that's going on in the private sector hospitals, you need to do something about making sure that you focus on investing in government hospitals, both in terms of infrastructure and its other medical resources, including human resources. All this is going to take a huge amount of investment if private sector doesn't have to bear the brunt and the burden of delivering healthcare to the citizens of this country. And I think there needs to be a very strong, focused collaboration and deliberation about how you're going to effect an optimal healthcare system in this country. Without increased investment, it's not going to happen. Okay?
Sure. Perhaps on the rollout of GST first time, we're going to be seeing a full-fledged budget in terms of policy on the pharma sector side and also on the healthcare sector side. What are the changes at a policy level that you're expecting in this budget?
So let me start with the pharma industry. I think that when you look at healthcare spend, I think drug costs and many of these hospitalization and treatment costs are becoming very, very large, especially in cancer and some of the non-communicable diseases. I would like to see all cancer drugs exempt of GST. I think that's the least the government can do. I think certain sectors like diabetes, these are chronic diseases, and therefore I think you need GST to be exempt. So diabetes is certainly one such sector. Hypertension is one such sector. So I think if you start looking at any chronic disease that requires lifelong treatment, and when you look at something like cancer, which is a very expensive disease to treat, I think drugs that come under this ambit must be GST exempt. That is my plea. Okay. Now when it comes to other aspects, there is the China aspect. We keep talking about the fact that India has surrendered many of the pharmaceutical strengths that it previously had, especially in antibiotics, to China. Now I think we're even seeing a large number of intermediates being imported from China, largely because of continued pressure on companies to reduce pricing, and which has seen a lot of companies just exit some of these spaces. I don't want to see any more exits. I don't think any Indian company should be exiting an API space or a bulk drug space, and I think we need to rebuild that space. Okay, the easiest thing to do is to sort of slap on some anti-dumping tax on duties on Chinese intermediates, but I don't think that's going to help either. I think we need to rebuild this whole sector by making sure that the sector has enough support from the government by way of either GST exemption, by way of certain tax incentives, whatever it is. I think you need to rebuild the pharma sector and what we were good at.
Do you see at research level some kind of support or any kind of exemptions, or particularly as far as pharma research goes, there has to be something that the budget has to offer for the pharma industry?
Well, this is an absolute must. I mean, if India has to innovate, if India has to regain its stature as a very strong research engine in pharma and biopharma now, without increased weighted tax deduction on R&D, this is not going to happen. And I'm very worried that when the government starts looking at reducing some of these weighted tax deductions, it's a death knell that we are actually serving to the research sector in pharma biotech. I really hope that the government, in its better wisdom, increases the weighted tax deduction on R&D, because without that you're not going to be able to build a credible research-led pharma and biotech sector.
Sure.
The other thing I also want to quickly add to this is that science and technology has to be a great focus, as a strategic focus for the country. And if we don't up our investment in science and technology, again, we are going to devalue our future opportunities. And I'm really worried that the government is continuously sort of sending signals that they want to cut back on research spends, on investing in science and technology. They're basically sending the signals to many of these research institutions saying, you must find that money. You cannot swing the pendulum from one to another so rapidly. After supporting all these institutes for a long time, you suddenly cannot just withdraw it. You have to basically strengthen them for some time more, and then get them to be incentivized to attract more investment from other sources.
Sure. Given the fact that a large portion of the Indian population is not insured, in terms of marginalized sector as far as healthcare system goes, do you think that we do need a policy that is a lot more inclusive, where healthcare costs are kind of taken care of for the marginalized sector, because diseases are not going to distinguish between a rich and a poor?
Absolutely. I think that the government owes it to every citizen of this country to basically provide basic health care. And I believe that through a universal healthcare system which relies on insurance and reimbursement and bulk procurement of both medical services and drugs, I think this can come about. But I think there needs to be a serious effort to deliver right to healthcare in this country. And I think at least let's start with the marginalized section of our population. I think many state governments has of course done that and shown that it is possible. I know that Maharashtra basically provided an insurance coverage to a large part of its under or below the poverty line population, and it worked. The problem is that there's this constant debate between, is this a central subject or is it a state subject? And very often the focus on universal healthcare gets diverted, because it's then basically pushed to the state governments to do. And very often the state governments are not able to do it because they don't have adequate resources. So it's a conundrum that has to be addressed, and I think there is a need for the center and state to have a very, very unified view on universal health care.
Sure. Great to have you with us. Thank you so much for your time.
Thank you.